How to diagnose silent GERD in seniors. How can we diagnose silent gastroesophageal reflux disease in seniors? This question is important, as older adults often experience different symptoms compared to younger individuals. Silent gastroesophageal reflux disease can be tricky because it does not always present with the typical signs like heartburn or chest pain. Instead, seniors may have subtle or unusual symptoms, or they might not report any symptoms at all, even when there is significant damage to the esophagus. To start diagnosing silent gastroesophageal reflux disease in seniors, healthcare providers usually conduct a clinical evaluation. Since older adults may not mention classic symptoms, doctors look for less obvious signs. These can include a chronic cough, hoarseness, frequent throat clearing, difficulty swallowing, or a feeling of a lump in the throat. Respiratory issues like asthma or repeated lung infections can also be linked to reflux. Next, medical history and risk factors play a key role. Physicians will consider age-related changes that can lessen sensitivity to acid in the esophagus. They will also look at neurological conditions such as Parkinson's disease or multiple sclerosis, obesity, and other factors that may increase the risk of reflux or reduce symptom awareness. Diagnostic testing is another important step. An upper endoscopy allows doctors to see the esophagus directly. This test can reveal inflammation, ulcers, or scarring caused by reflux, even if the patient does not report symptoms. Ambulatory pH monitoring is another useful test. It measures acid exposure in the esophagus over a full day to confirm any abnormal reflux episodes. Esophageal manometry assesses how well the esophagus is working. This can be particularly important for older adults, as their esophageal function may be impaired. For those suspected of having silent reflux that affects the throat, a laryngoscopy checks for inflammation or damage to the vocal cords and throat. Symptom questionnaires and scales can also help. These tools are designed to capture subtle complaints related to reflux that seniors may not mention. Lastly, it is essential to exclude other possible causes of symptoms. Since silent gastroesophageal reflux disease can overlap with other conditions, specialists may evaluate for lung or throat diseases before confirming reflux as the cause. Because older adults often have a reduced ability to sense acid in the esophagus, they may not feel or report heartburn, even when significant reflux is happening. This can increase the risk of complications like esophagitis, strictures, Barrett's esophagus, or respiratory issues if silent gastroesophageal reflux disease goes untreated. Diagnosing silent gastroesophageal reflux disease in seniors requires careful attention, thorough clinical assessment, and the appropriate use of diagnostic tools. Early identification is key to managing the condition and preventing long-term complications associated with acid reflux.